Hi everyone, my name is Dr. Anna Brodsky. I'm an anthroposophic physician and I also do NHS medicine. And I just want to make a short video about mistletoe. I had one and it got deleted by the YouTube, so I thought, what a pleasure, I get to do another one. So mistletoe is a plant that is like a parasitic plant that grows on the trees. So from anthroposophic perspective, it's quite interesting. This plant is not able to touch the ground. It cannot descend into the earthly realm, so it can only live off trees. But at the same time, it's not a typical parasite because it doesn't actually harm the trees. In fact, there is some evidence to show that those trees are more resilient to illnesses. And if you have seen mistletoe, it kind of grows like a sphere. So it's quite beautiful, really. So in anthroposophic medicine, the main illness that we treat with mistletoe is all types of cancer. It's also used for other things like chronic fatigue syndrome, for example, at sort of more gentle doses. But let's focus on the cancer. So when I have patients who come to me wanting mistletoe, I always want to make sure that they're not refusing to have all the usual treatments, simply because that improves the outcome. And sometimes it's a struggle to convey that message, but and of course ultimately I do respect my patients' decisions, but the outcome is better if you have all the treatments that are available. And my impression is over the years that modern chemotherapy and all cancer treatments is much more gentle than when I was actually training. And I think my first hospital job was oncology, and that was a very tough experience. But what I'm seeing right now with my patients is that they're tolerating chemotherapy, radiotherapy much better than the patients that I saw when I was just in training. So thank God for that. And thanks to the science. So mistletoe is produced by several companies, like for example, Iscador, Abnobo Viscum, Iscosin. You also have Helixor, and it's all mistletoe. Let's talk about how you take it. It's injectable. It's not worth taking it by mouth for cancer because it will be destroyed in our gastrointestinal tract. It won't be so effective. You can take it by mouth homeopathically, probably for different indications, not for cancer. In Aberdeen, Scotland, we have a center where you can have mistletoe infused, which means you check in there for a couple of days, you take somebody with you who will support you, and you actually will have infusion directly into your bloodstream with mistletoe. The reason that this method exists is because when you have never had mistletoe before, your body is likely to be more sensitive to it, and we can achieve to stimulate your immune system stronger, quite well, give you a boost at the beginning. And that will induce fever. And whilst you're having fever, you're not going to feel really good. Like any other time with fever, we feel sick, we feel exhausted, sweaty in bed, maybe vomiting, flu-like symptoms. So this is why in Aberdeen they like you to bring somebody with you who could, take care of you if necessary for those couple of days. The other way of administering it, which is my favorite, is subcutaneously. The reason it's my favorite is because, it's the one is most commonly used, because even if you have the infusion, then you get sent home with subcutaneous mistletoe injections. So most patients learn to do it themselves, and those who can't, they use, either a nurse or a relative. We aim for 3 times a week injections, but this is rather variable because when you do subcutaneous injections, you will get a local reaction, which means like a patch of redness. It could be tiny or it could be large. to avoid big, large reactions with lots of itching, lots of swelling, we usually start with low dose of mistletoe and work the dose up gradually and incrementally, because it's not helpful to have a massive reaction, especially when you're mentally not ready for it. You already feel ill with cancer and then you're worried, is it infection or what? The higher dose, even subcutaneously, potentially may cause fever as well. And when we haven't planned for fever, it can be quite disturbing and you may end up in A&E, which is not my goal. So this is another reason for introducing mistletoe very gradually. And of course, you know, your body then also gets used to it. So I often find the need for changing from one type of mistletoe to another, because also the situation changes. So for example, for a specific cancer that is local, I would prescribe one type of mistletoe, but then if the situation has changed in the metastasis, we also need to change the mistletoe so that it's more specific. So there is one more way of injecting mistletoe, and that is directly into a tumor. So this is done quite infrequently because the tumor needs to be superficial, accessible, and so on and so forth. And I do not believe that there is like a huge amount of evidence to say that one method of delivery is better than the other. I think subcutaneous is perfect because then you can be doing it yourself over a long period of time. And of course, treating cancer, it's quite good to take mistletoe for some years, really, even if you are in remission. The benefits of mistletoe, and I'm not going to go into research because I don't enjoy going through research papers, it's not my thing, but I will link them in the description, so if you want to look at individual papers, you can do. So mistletoe definitely helps with the feeling of well-being during cancer, so it increases the quality of life. There is a lot of evidence for that. It also stimulates our own immune system so that the person can actually fight cancer. There are different mechanisms for that. For example, lectins, which are proteins in mistletoe, some of them have cytotoxic effect, which means they actually directly kill cancer cells. And there is some evidence that it prolongs life as well. I think overall, mistletoe is the strongest medicine we have in the whole of anthroposophic medicine, as in, yeah, I will stand by that, the strongest. But I personally believe in using all modalities that we have. So for example, I'm so keen for my cancer patients to have something like emotion code, and I have done a separate video on that. I'm really keen for them to have therapy, but of course, whilst you're going through the cancer journey, it may not be a good time for therapy because it's already overwhelming and one doesn't feel well. So quite often it's really reasonable to cope with the immediate situation, like, you know, the surgery, like chemotherapy, like mistletoe, and then have the therapies later, because there is also a massive internal journey in terms of making sense of what has happened, finding meaning. I feel finding meaning is really important. And linking back to emotion code, in my other video I talked about it in more detail. Emotion code, I feel, is a great thing to combine with mistletoe for cancer treatment, because emotion code addresses emotions that we have not processed and that have gotten stuck in our system. And in his book, Dr. Bradley Nelson, who has invented this technique, he talks about certain cases of cancer who have had emotion codes, and that really helped the resolution of cancer. I do see stuck emotions from anthroposophic perspective as developing in the soul and then gradually incarnating deep into our system, going into the etheric body or energy body, and then into the physical. And those that have been with us the longest are, you know, the most damaging by the time we get to them. And it's interesting also, when you have emotion code done, it's our own subconscious that chooses which emotions to remove first for a particular, you know, request. Say, I want to have emotions removed linked with this particular illness. And the unconscious or subconscious always seems to go for the emotions that have been there for longest. So the ones that we have either inherited from our parents, grandparents, you know, they can go far back. And those that we have absorbed in our childhood, created in our childhood. So the ones that have been there for longest, they need to come out sooner rather than later. I think this is about it for mistletoe. I'm still to turn the comments on, and then you can comment and ask questions perhaps. I hope this is helpful. Sending you all lots of love. Bye.